Clinical stages of HIV in children and infants, looking at part 3. Here we are going to discuss the stage 4 and looking at general. There is again I have explained severe wasting. There can be stunting as well as the malnutrition. It is which is not responding, so it doesn't respond with the standard therapy. Then there is also the chronic herpes simplex infection. This is mainly the orolabial as well as the cutaneous of more than 1 month duration, or the visceral at any site. Then there can be the TB can be seen. There is the extra pulmonary TB as well as the disseminated non-TB mycobacterial infection. There is presence of the Kaposi sarcoma as well as the esophageal candidiasis. So esophageal candidiasis or the candidiasis of the trachea, bronchi or the lungs. Next, there can be involvement of the CMV, the cytomegalovirus, and retinitis can be seen as well as the cytomegalovirus infection. And this basically it can affect the another organ, and with the onset at the age of over 1 month. Next, they can also present with the disseminated endemic mycosis. This is nothing but the extra pulmonary histoplasmosis and the coccidiomycosis. Next, it can involve the chronic cryptosporidiosis and the isosporiasis. It can involve the symptomatic HIV associated neuropathy, nephropathy, or the HIV associated cardiomyopathy. Now we are going to look at the neurological aspect in stage 3. In stage 4, the neurological aspect. So here it can involve the CNS toxoplasmosis, and it is basically after 1 month. Then it can involve the HIV encephalopathy. It can also involve the cerebral or the B cell non-Hodgkin's lymphoma. Next, it can involve the progressive multifocal leukoencephalopathy as well as the extra pulmonary cryptococcosis, including the meningitis. Next, we are looking at the respiratory. In terms of respiratory, it involves the pneumocystis, pneumonia, as well as presence of the recurrent severe bacterial infections. This can involve the emphysema, pyomyositis, involves the bone or the joint infections, as well as the meningitis, but it does not involve the pneumonia.